Good morning, ladies and gentlemen. I'm really very happy to be here and to share with you our experiences. I'm GP with private practice for 4,000 patients. We are 2 doctors, 3 nurses, 1 office manager, and also I'm Vice President of Slovak Society GPs. I would like to share with you also some historical points, because now Slovakia is a member of European Union, but after Second World War we were together in one so-called Soviet Union. And as you see, 1948 we got something like Soviet healthcare system in Soviet bloc. What does it mean? Most chronic conditions were managed by the specialists to whom the patient was referred by GP. No continuity was in the family medicine, which we had in the last centuries, compared to developed countries like, for example, Scandinavian countries, for example, Netherlands, more than 100 years continuity in GP and family medicine. There was something was disrupted, and you can see that we were limited only for curative care, basal prevention, vaccination, basal blood testing, nothing else. But we are really very happy that our authorities understood that it's much better, much efficient to give GPs more competency, to be more efficient for the public funds and to be closer to the patient. Very shortly, you can see our new competencies in the last 10 years. Management of chronic diseases and also others. And I'm really very happy that, for example, in our practice, we can do abdominal ultrasound, which is also very, very helpful. We have 3 health insurance companies in Slovakia. One is the biggest one, it's a state, and 2 smaller, they are private. The ratio is between, let's say, 60% state, 30% one private, and 10% another private. There is a ratio between these insurance companies with the number of patients. And you can see that on the first graph, that compare 2019-2022, this is the numbers from state insurance company. Patients referred to specialists decreased down from 49 to 39%. This is significantly the people, they are more care from GPs, not from specialists. Second graph, you can see that we have a combined system of capitation and performances, paying for performances. And this is the second graph from private insurance company. And you can see that there is a money. There is a ratio between capitation and performances is going to the 70% around capitation and around 30% for performances. It means that there is going up. And all costs, and this is a graph which I'm really very happy to show you, that our authorities definitely understood that investment to primary care is very, very important. And you see in million euro from last private insurance company, that every year from 2020, 2021 and up to 2023, which is something like estimation or assessment of the cost, every year we are around 20% plus. Since 2020, we almost doubled, or the insurance company doubled expenses to investment to primary care. And closer to the patient, this is a case from my patient, young lady. With ultrasound, I found a stone in her gallbladder. And you see our modern approach to the patient. Patient with some symptoms come to me. I did abdominal ultrasound, sent to surgeon. Surgeon decided and setting the date of operation. Patient went back to me. I did preoperative examination and then sent to the hospital for operation. Versus old system, GP, radiologist, ultrasound, GP, surgeon, GP, internist for preoperative examination, GP, surgeon, operation, and back. The patient had to go only to 2 places, me and surgeon in hospital. And then you count me, radiologist, surgeon, internist, and again surgeon. There's much more closer to the patient. But last but not least, they're not about us. They're the decision makers, almost politicians. And now, these days, was established new government after the election in Slovakia. Sometimes it's shorter, but normally there's 4 years. And this is a new faces in our government. Mrs. Dolinkova, the Minister of Health, Mr. Kamenitsky, Minister of Finance, because if the two guys are not in line together, it's impossible to do something in the healthcare system. And guys, I'm looking forward to presenting you positive results for Slovak GPs at WONCA World Conference in South Africa 2027. This is my summary. You can find it in the program. And my last sentence. The all mentioned activities, including preventive examinations, are covered by public health insurance beyond decapitation. This results in a higher medical and economic motivation of the general practitioner. On the other hand, it brings a much higher efficiency in the use of public funds, since specialized care is much more expensive and difficult to access. Last but not least, a timely and efficient GP service for the patient significantly reduces the number of preventable deaths, but this is just my hypothesis, and we need to have more data for next research. Maybe in the future I will share this data with you. Thank you very much.